Bismillahirrahmanirrahim. My name is Dr. Ambar Arshad, and today the topic of presentation is antenatal care, and I am presenting under supervision of Professor Saira Afzal. In this presentation, I shall be giving a brief introduction of antenatal care, the objectives, antenatal visits, what are antenatal checkups, what are the warning signs, what vaccines are recommended during pregnancy, and recent updates, and in the end we will be having a MCQ session. At the end of the presentation, the participants will be able to describe the objectives, the essential components and needs for better antenatal period. Now, what is antenatal care? Antenatal care is the care of the women during pregnancy. The primary aim of antenatal care is to achieve at the end of the pregnancy a healthy mother and a healthy baby. Ideally, this care should begin soon after conception and continue throughout pregnancy. The main objectives of antenatal care are to promote and protect the mother during the pregnancy, to detect high-risk cases and give them special attention, to foresee complications and prevent them. Also, counseling is important, and to remove anxiety and dread associated with delivery is important, to reduce maternal infant mortality and morbidity by timely interventions and timely detection of any risk present during antenatal period, to teach the mother's element for childcare, nutritional, personal hygiene, environmental sanitation, to sensitize the mother to need for family planning, and to attend the under 5 accompanying the mother. According to WHO, there are recommendations on antenatal care for a positive pregnancy experience. So for the quality throughout the quantum of care, WHO envisions a world where every pregnant woman and newborn receives quality care throughout the pregnancy, childbirth, and the postnatal period. And it prioritizes the person-centered health and well-being. The main aims, according to these recommendations by WHO, are to reduce mortality and morbidity, provide respectful care that considers women's view, and optimize service delivery within health system. So what is the positive pregnancy experience? A healthy pregnancy for mother and baby, including preventive or treating risk, illness, and death. Physical and socio-cultural normality, affect transition to positive labor and positive motherhood, which includes maternal self-esteem, competence, and autonomy. Now a little bit about the antenatal visits. There are two models. One is the focused antenatal care model that was implemented in 2002 by WHO. And this model suggested 4 standard visits. First visit between 8 to 12 weeks, second between 24 to 26 weeks, third visit at 32, and the last 36 to 38 weeks. And return for delivery at 41 weeks if not given birth. But a new model of antenatal care is provided by the WHO, and it has been implemented since 2016 to reduce the perinatal mortality and to improve women's experience care. There are total 8 contacts, minimum 8 contacts recommended by this model. First contact up to 12 weeks, second 20 weeks, third 26 weeks. Then the third trimester visits have total 5 visits at 30, 34 weeks, 36 weeks, 38 weeks, and 40 weeks. Previously, the 4-visit model of WHO for antenatal care involved specific evidence-based interventions for all women and carried out at 4 critical times. It had 4 antenatal visits. And as I've already told, it was focused antenatal care model. But now the new model for antenatal care focuses on the 8 contacts. Actually, the contacts or that the mother should come to the antenatal center and get a full antenatal checkup, so that any complication or any kind of condition or any symptom is not missed. So according to WHO, there was a report where they evaluated in different continents how women were attending the antenatal centers with at least 1 antenatal care or with 4 antenatal care visits. And in South Asia, the red line shows the one visit, the percentage of one visit, and the green line shows the percentage for 4 antenatal care visits. And it can be clearly seen that the percentages are higher in Eastern Europe and Central Asia and Latin America, whereas percentages are quite high for the four antenatal care visit in South Asia and Africa and Africa. This is the map showing the percentage of women aged 15 to 49 attended by a provider at least 4 times during the pregnancy between 2015 and 2020. This map shows the lowest levels of antenatal care observed in sub-Saharan and in South Asia. And in Pakistan, as you can see, the color of Pakistan falls in this brownish region. So the percentage is 51%, and this percentage was taken from DHS 2017 to 2018. Similarly, there is also discrepancies between the percentages of women attending between rural and urban areas, and the percentages in urban areas is quite high as compared to the rural areas. However, globally, while 87% of pregnant women access antenatal care with a skilled health personnel at least once, less than 3 to 5, 59% receives at least 4 antenatal care visits. And in regions with highest rates of mortality, such as Western Central Africa, South Asia, even fewer women receives at least 4 antenatal care visits, around about 53% and 49% respectively. So why early pregnancy detection is important? It is can be done by urine samples and by blood samples, and it facilitates proper planning and allows for adequate care to be provided during the pregnancy. And it is done by either recording the last day of menstrual period, and it calculate the expected date of delivery by adding 9 months and 7 days to the last date of menstrual period. The health status of the mother can also be assessed, and any medical illness that she might be suffering from can be detected if the pregnancy is detected early. It also helps in timely detection of complications, and early detection of pregnancy and provision of care from the initial stages facilitates good interpersonal relationship between the caregiver and the pregnant women. So what are the antenatal checkups and what preventive services can be provided to a mother at the healthcare facility? So the essential components are to take the detailed history, conduct a physical examination, conduct abdominal palpations for fetal growths, and carry out laboratory investigations. So for the history taking, first is to confirm the pregnancy, first visit only, and identify whether there were complications during any previous pregnancy. Take surgical and previous surgical and medical history. It is important to record the first day of last menstrual period to calculate the expected date of delivery. Also, record the symptoms if any complications like fever, persistent vomiting, abnormal vaginal bleeding, or discharge is present. History of current systemic illness is important, and history of drug allergies and habits. On physical examination, it is important to check pallor for anemia, pulse rate, respiratory rate, and edema. Edema, which appears in the evening and disappears in the morning after a full night's sleep, could be a normal manifestations. However, edema on hands, feet, and abdominal walls and vulvas is abnormal. Blood pressure measurement is also important because blood pressure rules out the disorders of pregnancy. Like hypertension is diagnosed when two consecutive readings taken 4 hours or more apart shows the systolic blood pressure to be 140 or more and diastolic to be 90 or more. And high blood pressures during pregnancy may signify pregnancy-induced hypertensions or chronic hypertensions. Albumin in urine is also important. That indicates preeclampsia if the level is more than 2 plus. And weight is also important to ensure that the women's nutrition is adequate and the normal weight gain is 9 to 11 kgs during pregnancy. During abdominal examination, it is important to measure the fundal height. There are standards on palpation that if the fundus of the uterus is felt at the pubic bone, then it's 12 weeks. Between the umbilicus and the pubic bone is 16 weeks. At the umbilicus is 22 weeks. And while reaching the Xiphi sternum, it's 36 weeks. It's important to hear the fetal heart sounds and also to assess the fetal movements. And the fetal movements can be felt by the examiner at 18 to 20 second week by gently palpating the abdomen. Also, it is important to assess the fetal parts Multiple pregnancies can be detected. Fetal line presentation is important, and inspection of abdominal scars is done during abdominal examination. So assessment of gestational age, the gold standard is the ultrasound, early ultrasound, and gestational age, as I have already told, can also be calculated from the last day, from the first day of the last menstrual period. And an anomaly scan is recommended to detect any unusual developmental findings at 18 to 22 weeks. So, what lab investigations are important? In Pakistan, several facilities are available at the BHU level, and like pregnancy detection test, hemoglobin, blood grouping, urine test for presence of albumin and sugar, rapid malaria test. Dengue counters have also been developed, and blood sugar testing is also being carried out at BHU level for pregnant women during antenatal visits. The tests like VDRL, HIV testing, rapid malaria tests, and hepatitis B screening is done at higher level like RHC, DHQs, and THQs. Uh, During counseling sessions and interventions, the female can be counseled regarding the supplementation of iron, folic acid, immunization, groups or individuals on nutrition, planning self-care, delivery, parenthood, home visiting by e-family worker, and referral services where necessary. So, what prenatal advice can be given to the female regarding diet that overall consumes 60,000 calories over the normal metabolic, and lactation demands around about 550 calories a day if she is a lactating mother. On the left side is the diet chart, total of 2,580 calories with balanced diet of eggs, avocados, a steak, and some fruits, and a roti and some curry. So for personal hygiene, rest is important. Bowels for bowel habits must be good. For constipation, the pregnant female should avoid constipation by regular intake of green leafy vegetables, fruits, and extra fluids. Exercise is important. Light household work is advised, but heavy exercise is not recommended. And it is advised that cut down smoking and alcohol, and dental care is also important. Drugs must be taken with caution, and X-ray examination in pregnancy should be carried out only for definite indications. Here are some warning signs that the mother should be given clear-cut instructions, like if she is having fits or convulsions, severe headache with blurring of vision, severe bleeding and discharge per vagina, persistent vomiting, severe abdominal pain, and persistent back pain. These are the signs that the mother should be counseled that if she faces any one of them, then she should immediately go to a medical health facility. And the graph on the left side shows that the most common warning sign reported is the severe vaginal bleeding, followed by persistent back pain, severe abdominal pain, and so forth. Here for the specific health instructions for anemia, it is important that the mother should be fully aware, and the daily oral iron and folic acid supplementations are required. 30 to 60, according to WHO, 30 to 60 milligrams of elemental iron and 400 micrograms is recommended for the pregnant women to prevent maternal anemia, prepare sepsis, low birth weight, preterms, and it also helps in spinal prevention of spinal and brain deformities. Toxemias of pregnancy is important. That includes eclampsia and preeclampsia. When a mother presents with albumin urine with increased blood pressures, edema on the body, and when there are fits, then we label it as eclampsia. Important vaccinations there. The tetanus vaccination is also important, and two doses of tetanus toxoid is given. The screening for syphilis can also be done, and the history should be complete history should be taken if there is a contact with any type of contact with a person or with having German measles. So, coming to the vaccines, the CDC recommends that pregnant women get two vaccines during every pregnancy. One is the flu vaccine that is in the inactivated forms, And CDC recommends getting the flu vaccine if you are pregnant during flu season. While flu seasons vary in timings, recommends getting vaccinated by the end of October if possible. And the Tdap, it's tetanus, diphtheria, and acellular pertussis. And pregnant women are also encouraged to get the Tdap vaccines at any time during the pregnancy and optimally between 27 to 36 weeks. Here is a chart showing the recommended vaccines during pregnancies. Influenza, inactivated, and Tdap I've already mentioned. Hepatitis A and B are also recommended if other high-risk conditions are present. HPV and pneumococcal are not recommended, and contraindicated vaccines are all live vaccines, live MMR, varicella, zoster, and influenza LA4. Maternal preparation is also important. Family planning is also important while during the antenatal visit. Family planning is related to every phase of the maternity cycle, and the mother is psychologically more receptive to the advice on family planning than the other times. So educational and motivational efforts must be initiated during the antenatal period. And advice with pets at homes. It is generally safe to have cats while you are pregnant too, like dogs. You must watch the bites, scratches, and licks because the cat's feces contains the parasite that causes toxoplasmosis. Now it's time for the recent updates. Here is the paper that is published recently related to the new model of antenatal care. This new model of antenatal care includes the supplementation of iron folic acids, focuses on the ultrasound scan before 24 weeks, and antihelminthic treatments. And other recommendations of this models is syphilis testing, counseling of on pregnancy danger signs. So the main aim is to achieve the maternal outcomes, like infection, side effects, symptomatic relief, fetal neonatal outcomes, preterm births, congenital anomalies, test accuracy outcomes, sensitivity, specificity, and health system outcomes, antenatal coverage, and facility-based delivery. These outcomes of interest guide the development of new WHO models. There are special considerations for pregnancy regarding COVID-19 treatment. Pregnant women should be counseled about increased risk of severe disease of SARS-CoV infection, and if they are hospitalized, then COVID-19 is indicated for pregnant patients. Care should be provided in facility that can conduct maternal and fetal monitoring. So for management of pregnant patients, fetal and uterine contraction monitoring is based on gestational age when appropriate. Individualized delivery plan is there. A multi-speciality team-based approach is present, including pulmonary critical care, pediatric specialists, and infectious disease and maternal fetal medicines. Therapeutic management of pregnant patients with COVID-19 should be the same as non-pregnant. Pregnant and lactating patients with COVID-19 should discuss the use of investigational drugs and drugs that are approved for other indications. And the decision to feed the infant breast milk while the patient is receiving therapeutics for COVID-19 should be collaborated effort between patient and the clinical team. Here is another paper regarding the developing measures for WHO recommend on antenatal care for positive pregnancy experience, and it focuses the same four goals of the antenatal care, providing good antenatal care to the pregnant female. Assessing the knowledge and understanding of OPS danger signs among patient women in Bhutan, they had the results showed that there was a good level of knowledge, and most pregnant women had satisfactory score with poor expected recall of danger signs. And in Pakistan, this study was conducted focusing on the factors affecting the utilization of antenatal care among married women of reproductive age. And this was a case control study. It included questions related to socio-demographic, access-related factors, utilization of antenatal care when asked. And the conclusion was that the road network detail has no measurable impact of antenatal care utilization. Nulliparous women having knowledge of antenatal living in well-constructed house with electricity was found to be utilizers of antenatal care. And it is recommended that awareness and health education should be arranged for pregnant women in rural areas, Pakistan especially. Now, another press release shows that millions of pregnant women pregnant mothers and babies born during COVID-19 pandemic threatened by strained health systems and disruptions in services. So in Southeast Asia, the highest numbers of births in 9 months since COVID-19 was declared. In India, 20 million; in Pakistan, 5 million; in Bangladesh, 2.54 million. And this posed a global containment measures such as lockdowns and curfews posed several challenges like at healthcare centers, like the shortage of supplies and lack of sufficient skilled birth attendants that affected the antenatal care. So the last paper shows the impact of COVID-19 pandemic of maternal health services in Pakistan, shows that COVID-19 outbreak can result in increased maternal mortality. So government should take strict actions and timely measures to control maternal mortality and abnormalities. The government should allocate funds to necessary measures, and awareness campaigns should be launched with the help of healthcare professionals to educate women population regarding maternal health care during this COVID-19 outbreak. Now it's time for the MCQs. First MCQ is: a lady who is pregnant or considered pregnancy should get a health checkup. Which of these vaccinations should be up to date before they get pregnant because of the danger of the disease to the fetus? Either it's tetanus, it's diphtheria, or
C.
it is measles, mumps, rubella, or flu. Yes, the answer is C,
C.
because a measles, mumps, and rubella is a live vaccine, and as I have already showed the table that live vaccines are contraindicated. So, measles, mumps, and rubella is the option. A 21-year-old woman presents in OPD for a routine antenatal checkup. At 22 weeks of gestation, where would you expect to find the uterine fundus?
B.
Yes,
Like yes.
so it's a standard set that at 22 weeks, the if the everything is okay and the normal parameters are present, then the fundal height should be at the
B.
uterus. Most women can meet their increased needs with a healthy diet that includes plenty of fruits, vegetables, whole grains, and proteins. Infants born to mother who are vegan may be at increased risk of deficiency of which nutrient? Vitamin C, vitamin B.
B. Vitamin B12.
Yes, vitamin B12 is
B.
the right answer. Suppose a young lady comes to you at 32 weeks of her pregnancy. You discover that her blood pressure is 120/90. She has mildly pale conjunctiva and the fundal height is measured at 38 weeks of size. What could be the possible reason for this fundal height? Oligohydramnios, preeclampsia, twin pregnancy, or history of smoking in mother?
C.
C.
B.
No, the answer.
B.
Uh,
B.
Um, as I have only mentioned the blood pressure of 120/90, and I have not mentioned any other signs with plus urine plus or edema, so preeclampsia is not an option. The oligohydramnios states that the fundal height should be less. History of smoking in mother, if is present, then the chances of intrauterine growth restriction. So the here the fundal height is more than the expected date. So the twin pregnancy is the right answer. Suppose a 27-year-old pregnant woman comes to see you. She tells you that this is her first pregnancy. The last time she saw her was on 25 weeks ago. So when would be her normal visit? Next visit.
30 to 32 weeks.
Yes, according to the new model of antenatal care, the fourth visit in the third trimester is due after 24 weeks, is due at 30 weeks. So the option is 30 to 32 weeks. The next is: healthcare providers advise people to take 400 micrograms of folic acid daily before they get pregnant or during pregnancy. But this helps prevent in the baby. Respiratory distress,
C.
brain, yes. Spina bifida is the condition that mainly
C.
focused while advising folic acid. So it prevents brain and spinal cord defects. A disease contracted from parasite found in cats can cause nerve damage to the unborn child if the mother becomes infected. The disease is known as rubella toxoplasmosis.
Toxoplasma.
Yes,
B.
it is important because people usually keep pets,
B.
and it is important to raise awareness that the cat's feces should be cared handled with care during pregnancy, because there are chances that the cat's feces might have toxoplasmosis parasite. A 35-year-old woman who is now in her fifth pregnancy with four alive issues presented in the antenatal care and is diagnosed as a case of anemia. She consumes green leafy vegetables and fruits, and her diet is deficient in meat products. Cause of anemia in her case is either folate deficiency, sickle
C,
cell, thalassemia, or iron deficiency.
C.
Yes, as I have indicated, the consumption of green leafy vegetables and fruits, and there is no indication, and it seems from the history that there are four live issues. So, any kind of pathological blood disease, the chances are less. So, here the cause of anemia can be iron deficiency. So, the answer is C. A 19-year-old primary gravida comes in emergency at 32 weeks. She is complaining of blurring of vision, gross edema, and her BP is on the higher side with 170
D,
and 115. What is the most likely diagnosis? Hypertension,
C.
renal.
D,
D.
Yes, the answer is D. As I already told that if there is a history of fits with high level of blood pressure and edema and blurring of vision, then we will label as eclampsia. Otherwise, it would be pre-eclampsia. So the answer is D. A 32-year-old primary gravida presents to you at 14 weeks of gestation. She is concerned about normality of the fetus. At what time you will advise her detailed fetal anomaly scan? Between
C.
yes,
C.
yes, are
C,
recommended by WHO is 18 to 22 weeks. And last is a 37 a 7 week pregnant woman attends an antenatal care at a primary center, and she had not had any antenatal visit till now. The best approach regarding tetanus immunization is give a dose of tetanus and explain to her that it will protect the newborn and should take second dose. Do not do not waste TT vaccine. Give one dose and explain it will not be useful for the pregnancy and give her anti-tetanus along with TT vaccine.
A.
Yes, the right answer is
Oh,
A because two
A,
doses of TT tetanus toxide are important, and if two doses are taken, then the complete immunization will be provided. So this is the key, and thank you so much.
Thank you very much, Dr. Ambar. It is a wonderful presentation, and I have seen that your grip on research that has been increased tremendously over the years. So it is wonderful how you have presented different researches, especially the recent advances, and how you have given us the overview of the research, especially in COVID-19 situation and pregnancy. So maternal and child health, again, a very important topic during COVID-19 pandemic. We all know that 2020 has been a very hard year as COVID-19 has causing the strain in our health systems as well as the disruption of essential health services, including the services to the mother and child health. The most important thing that I should appreciate is that your slide number 8. If you please go to your slide number 8, where you have shown us the recent advances.
8, ma'am. Recent advances. Here, ma'am.
Right, recent updates. This is recent updates, please. Next slide. Right. I want each and every student to present. Please, if you go to your previous slide, please. Your previous slide, yes, this slide. I want each and everyone to show us the recent updates or the research updates that is concerned or with that topic. So this is the slide that I would appreciate. This is the most beautiful slide, and I want each and every student to please make it compulsory in your presentation that you are also going to show this slide in all the future presentations. So mark my words, make a note and highlight it that you have to present this slide, recent updates in every presentation that is following after this date, that is 5 August 2021. So the next important thing that you have presented is about COVID-19 scenario. And again, a lot of things have happened, and we come to know that COVID-19, it is affecting the health systems and health services. However, the pregnant women, they are giving birth to normal children. This virus, SARS-CoV-2, is not known to cause any malformation or any disformity in the newborn. Another important point that I want to highlight here is about the vaccination. So, Dr. Amber, what would you say about the vaccination of the pregnant women with COVID to prevent COVID-19 with the vaccines that are available in Pakistan?
Ma'am, regarding the vaccination of pregnant women during COVID-19, there were trials. Three in Pakistan: Sinovac, Moderna, and Sinopharm and Pfizer. These are the vaccines that are easily available at our centers, and there are recommendations that as the pregnant females are at risk of this COVID-19, they must get vaccinated. They get their regular two-dose vaccine from their nearly available centers. And there are considerations for mothers who are lactating, but for pregnancy, there are several research papers that shows that the pregnant females should get vaccinated during this pandemic.
Okay, thank you. There are two important issues. One is the pregnant ladies, and other is the lactating
Lactating
mothers.
mothers.
As far as pregnancies are concerned, there is a very clear guideline from National Command and Operating Center (NCOC), as well as from the SIAC Corona Expert Advisory Group, that Moderna, Pfizer, messenger RNA vaccines, they should be preferred in all women who are pregnant, and it is written in the guidelines. We know that even the Sinopharm, Sinovac, and all those vaccines that are consisted of killed SARS-CoV-2 virus, spike proteins, etc. These vaccines are equally good for pregnant women. Not a single case of any side effect of vaccine has been reported on from Pakistan or from the neighboring countries with the pregnant women who are being vaccinated. So it is very clear in the guidelines that all the messenger RNA vaccines like Pfizer and Moderna, they must be given to the women who are pregnant. Moreover, if a pregnant lady is vaccinated with other vaccines that consisted of killed, that is killed type of vaccine, again, they are safe for the pregnant ladies. Now, the next question is about the lactating mothers. We all know that the lactating mothers, they are being encouraged to keep